Hello.
Hi, Joanne. It's Emily and Eugene.
Hi. Thanks for getting in on time. We're just waiting for several people to log in. So good afternoon, everyone. I am Joanne Fisher, and I'm the support group leader for Tri-State Connect. Today we have two speakers joining us, Eugene Tomkill, LCSWR. He's the Rheumatology Social Work Manager for the Adult Rheumatology Division. He oversees social work services and promotes the integration of care for rheumatology patients by collaborating with rheumatology physicians, supervising the social work staff, and participating in rheumatology research initiatives. Mr. Tomkill received a Master of Social Work degree from the Hunter College School of Social Work and has advanced training in psychodynamic and experiential psychotherapy. He has an extensive background in mental health, including working with patients who experience concurrent health and mental health conditions. Also on the line today talking is Emily Reese, Senior Social Worker 1, Rheumatology. She serves as the Senior Social Worker 1 for the Adult Rheumatology Division. As a staff member of the Department of Social Work Programs, Mrs. Reese also coordinates all social work-related services for the Scleroderma, Vasculitis, and Myositis Center, including assessments, interventions, and access to needed resources, as well as referring patients to HSS support and education programs. Mrs. Reese received her Master's in Social Work degree from Columbia University School of Social Work and has a background working in liver disease and transplant. Mrs. Reese's professional interests include psychosocial aspects of coping with chronic illness, patient education, and healthcare equity for LGBT communities. Thank you both for speaking today, and we are looking forward to hearing what you have to say. Thank you.
Thank you, Joanne. This is Eugene Tomkill. I just want to clarify that Emily and I are with the Hospital for Special Surgery, just so everyone is aware of that. So thank you for inviting us to participate in this event today. It really is an honor and a really important interest of ours in terms of addressing what has become a very big concern for many people this time of the year, having to do with depression, the holiday blues, and coping with their chronic illness. As December rolls around and now it's already mid-December already, people are thinking about holidays and how they're going to spend their time during this month, times of celebrations, festivities, and obligations. And for some people, they may not be involved in any of those things, and they see other people who are involved in all kinds of activities that are going on, and people have reactions to all of that, whether they're obligated to participate or they feel they don't have anything to participate. And this can increase feelings of stress, anxiety, as well as sadness. And for many people, there are unmet expectations. Pressure to socialize, even if we're not feeling up to it, both physically not feeling up to it, emotionally not feeling up to it. And there's also for many people a sense of feeling left out, either because they can't participate or they're not invited to participate, etc. And there can be a real struggle to balance what you want to do versus what you're able to do. One day you might emotionally or physically be feeling very capable of participating in a number of events, and then that can change pretty quickly, and you can feel exhausted or experience pain, and it has a big impact on how we feel about ourselves, what we have to look forward to, and can really make us feel sad and frustrated. And what I want to highlight here is that many people at this time of year, when they're experiencing these things, they call them the holiday blues, holiday depression, and we will talk about those, that idea of the holidays and how it affects our mood and might create a feeling of being sad or feeling depressed, as well as how to cope with that. But before we do that, I also want to just outline and give some general information about depression in general, which is something that is very common that people struggle with, and particularly at this time of year, they tend to think about it more and experience it more. So I just want to go and give an overview of depression. So with that being said, everyone feels sad sometimes, and these feelings pass after a few days, maybe after a week or so. Feelings of sadness, might feel a little down, and it's not uncommon to hear somebody say, "Oh, I'm depressed today." That's a mood state. That's something that fluctuates. They're reacting to something that's going on in their lives in that moment. But when we're talking about a clinical depression, a diagnosis of depression, that's something that lasts much longer. That's not something that just goes away after a day or two or a week. And that's something that can be very severe, where it interferes with a person's ability to eat, sleep, to have satisfying interpersonal relationships. It really can just drag people down to where they feel like there's not much that they can do or enjoy in life. And some of the signs of a clinical depression include, I'm going to just go through a couple of the signs, and I want to also clarify that these signs that I'm about to talk about are not related to another condition. So it's not because of someone's other physical condition, for instance, that they're feeling this way, but this is something that seems to be apart from that, although there can be some relatedness, and we'll talk about that in a minute. So a feeling of being sad or empty inside, feeling hopeless, irritable, or having a loss of interest in one's favorite activities. So something you might have enjoyed for years, suddenly you have no interest in anymore. People report being very tired, and that tiredness is something that's not related to their physical condition, but there's something else going on. Sleep can become a big issue for people with depression. Sometimes it's that they sleep too much. They can't get out of bed. They constantly find that they have no energy and they just want to sleep. Other times people can't sleep enough. People will go to sleep fine and then they wake up and they can't get back to sleep. Changes in appetite. Again, not related to another physical condition, but sometimes people find themselves overeating. There's excessive eating, or not being able to eat at all. They just don't have an appetite. And again, all of these things can be related to other conditions, which is why it's important to always talk to your doctor if you're experiencing any of this. But these are also some signs and symptoms of depression. And one of the most serious signs or symptoms of depression are thoughts of suicide, of wanting to hurt or kill oneself. Depression can look very different in different people. There is a variation in how severe the symptoms can be. There are also some studies that have shown that for women who report experiencing depression more frequently than men, but women generally report that they feel sad. That's a common description that women have when they're depressed. For men, they're more likely to report feeling irritable or angry. And again, these are general remarks. This isn't everybody. Of course, there are women who are depressed that can appear and feel very angry, and men who feel very sad. But that's just in general what people have noticed. So that's kind of just an overview of depression in general. And another aspect of that I want to talk about is again, being that it's this time of year, December, the days grow shorter, nights longer, and eventually the weather will get colder, I guess. But it's seasonal affective disorder. So seasonal affective disorder is something that became more widely recognized about 30 years ago. And people, they talk about just having the winter doldrums, or they're just low energy because of the weather. But seasonal affective disorder is really a clinical depression, and it's characterized by a seasonal variation that recurs every year as the days get shorter and there's less natural daylight. But the symptoms are the same symptoms that somebody who has depression all year long experiences. And just because it's seasonal doesn't mean it shouldn't be treated or that people should ignore it. It's something that can be managed, and people can receive help and get relief from it. So I just want to point that out. And some of the ways that depression and seasonal affective disorder are treated are with medications. There are a variety of antidepressant medications and psychotherapy, sometimes a combination of both medication and psychotherapy. And then sometimes in less severe depression, lifestyle changes can also be very helpful, and that's something that a healthcare provider can talk to you about. But there's certain things like getting enough exercise and diet and just even our social supports that can have a serious impact on our mood, and that's just something to keep in mind. I also just want to point out, as we're talking about depression, is that if you experience these symptoms, you should contact your healthcare provider. Even if you're assuming that it's because of something that will pass or it's related to a physical condition, it's important to talk to your healthcare provider because they might be able to help alleviate these symptoms. Often people don't talk to their doctor because they assume there's nothing that they could do or they should just figure this out on their own. But according to the National Institute of Mental Health, in 2013, there was an estimated 15 million adults in the U.S. who experienced a major depressive episode. And keeping it to yourself or struggling alone doesn't help. It only makes it worse. So I just want to make sure people are encouraged that if they are experiencing any of these symptoms or struggling with any of these signs, that they reach out and speak to somebody. Of course, there are some other factors to consider, again, which you should speak to your healthcare provider about, which, chronic illnesses can make mood symptoms worse. It can be an aspect of the illness that can contribute to the depression. It can be a reaction to the illness. And again, it's all worth talking to your doctor about. It's not something people need to keep to themselves. Medications can affect mood. And that's something, again, that it's important to speak to your doctor about. And every patient, all of us, deserves to have a comfortable relationship with our doctor where we can talk about any of these issues that come up and are bothering us. And that's something that everyone should feel comfortable doing. It's very important to feel comfortable with your doctor to talk about any changes you notice in your mood or your physical health. So this brings me now to the holiday blues. So the holiday blues is it's different than clinical depression because, as the name indicates, it's usually something that occurs around the holidays. And the holiday blues are people experience this, when they might not be particularly sad or depressed at other times of the year. But, they notice that with the impending, holidays coming, they start to report feeling sad, lonely, and many of the other signs that people with depression experience, but it's very particular to dealing with the holidays and stressors around the holidays. People who do have chronic depression and have depression throughout the year might experience an increase in their symptoms during this time of year. And there's a number of things that that can cause this. There's the expectations that we all have of the holidays, buying gifts, receiving gifts, attending parties, hosting them, or quite often it's just expecting to be feeling joyful, but we might not feel that way. We might actually feel unfulfilled. We might feel lonely. Some people describe an unbearable loneliness around the holidays because it's when they feel most isolated or feel apart from other people. And that's that's a very difficult thing to deal with, and it's important that people speak up and share their feelings about this with other people, because handling this alone can only make it worse. Certainly the media, the media is constantly showing us images, both TV, print, and social media. During the holidays, showing constant images of smiling, happy people, and it really can create an unrealistic expectation for many people. And it leads us to assume that everyone else is so much happier than we are during this time of the year. And that feeling of sadness can grow and can increase. And again, many people just keep it to themselves, creating what really is often described as an unbearable loneliness, that they're just by themselves and other people are enjoying all the fun. Another important thing about the holidays and that can affect the holiday blues are it can be a reminder of what once was. It kicks up feelings of loss and grief. It might not happen every year, but then suddenly one year you find yourself really missing someone or something, something in your life that's changed, an aspect of yourself that is changed, and it can be unpredictable. And again, sharing those feelings with others often has that that mutual aid that we get with connecting with other people who also experience those losses can be very helpful. Sometimes people don't really feel like socializing during the holidays, and they don't really have anyone they want to spend much time with. And there's a balance there of spending time alone if that's what makes you more comfortable versus trying to spend time with others, because social isolation can increase feelings of sadness. So that balance is a good thing, and even connecting with others on a support group, for instance, or just speaking to a friend, or just having some contact with other people during the holidays in particular can be very helpful and very important. I just want to point out that if this is the holiday blues, it goes away. These feelings go away after a few weeks. The sadness and depression might continue, and if that happens, well, then you should speak to your healthcare provider, speak to your doctor, speak with somebody that you feel comfortable with to see if there's something that can be done to help with that situation. The other thing that's important to remember is that for some people, the holidays actually can do just the opposite. It can actually make people feel a little bit better. Sometimes people during the year feel more alone and isolated, and having the holidays in their lives makes them feel a little bit happier and joyful because they're focused on activities and connecting with people. And then January comes, and then they have the post-holiday blues, and that can be very serious as well. People, after all the holiday parties and celebrations, etc., people might feel very lonely. And staying connected with others during that time is important. Again, support groups, friendships are all very helpful in combating some of those feelings of loneliness during the post-holiday blues. But if it doesn't go away, or people notice that you continue to feel depressed or it gets worse, then again, don't keep that to yourself, and that's something to talk with a healthcare provider about. I also just, lastly, in terms of talking about depression and holiday blues, want to point out that for some people, it can be very, very difficult to manage, and the feelings of sadness at times can be accompanied by suicidal thoughts, or just a sense that they're so stuck they don't know what to do. And there are resources, and we're going to give some resources at the end. But I do want to point out that if for anybody feeling that they're just so stuck and they don't know what to do, or feeling suicidal, the National Suicide Prevention Lifeline, which is 1-800-273-8255, or 1-800-273-TALK, TALK, is a very helpful resource for people. And at the end of this conversation, we will provide some other resources that many people find helpful as well in terms of dealing with this. So at this point, I'm going to hand this over to Emily, who will talk about some of the other additional stressors and tips that people might be dealing with at this time of year.
Thanks, Eugene. There are some specific stressors that can happen whether you have a chronic illness or not, and we're going to touch on some of those specifically for those people who have scleroderma, and may relate to some of the stressors that I'm about to discuss. The holidays are a wonderful time for some people, but they also can bring about many different stressors that can exacerbate many symptoms and different feelings that people may have about their illness. For example, traveling can be very difficult. Many people don't live near their family or friends, and so they need to travel to see their friends and family and to celebrate the holidays. And this can be difficult both financially, because traveling can be expensive, especially during the holidays, but can also be challenging because of health-related concerns. So if you need specific medications, or you need, infusion before a trip, or there are different modes of transportation may take longer than others. So these can all kind of be exacerbated when you have a chronic illness. There are also feelings that may come up of obligation, feeling a sense of obligation to others to be present physically and emotionally, and that can feel like a big responsibility for people, especially if they have a chronic illness, because their illness can be often unpredictable. So one day they may feel well, the next day they may not, and so you may feel that it's hard to commit to things because you don't know how you will always be feeling, especially if it's a big trip or you're traveling far from your home. Some of the kind of going along with that, some of the physical demands of the holidays, and aside from traveling, can also be some of the things that we get the most enjoyment from. So decorating for the holidays, going to parties, and cooking. These are all activities that tend to go along with the holiday season, and they can cause us to overextend ourselves sometimes by having create an increased level of exhaustion, tension, frustration, feelings of sadness, and also a sense of loss, as you may not be able to do as many of the things as you've done in the past, especially if the holidays were a time that you were very actively involved in cooking and being the life of the party or the center. Your home was the center of all the festivities, and now you may not be able to take on those responsibilities as much anymore. There are also pressures financially to spend money during the holiday season. The holiday season tends to be defined by spending money and buying gifts for people, and this can really impact our finances, especially if you're on a fixed income, on disability, or have not been able to work because of your scleroderma or chronic illness. And so, some examples of this are, we're expected to buy gifts for lots of different people, and if we're not able to do that as much anymore, this can really cause a lot of stress for people. Family relationships also bring their own unique challenges, whether you have a chronic illness or not, and the holidays definitely can bring that up sometimes for people, especially if they do not always see their family as often as they would like, or just are sort of put in a position where they need to see family members that they have not seen in a long time and may not also be aware of their condition. As much as your friends and family may want to understand your disease, they may still have questions or not fully understand how you are feeling or where you're coming from. They may try to miss when they may try, but they may miss when it comes to grasping how your chronic illness may affect your ability to participate in holiday festivities, and this can increase your stress level. I think Eugene touched on this earlier, and I did as well, but scleroderma often has a very unpredictable nature, as many chronic illnesses do, and so every day you may feel different, better or worse, and the unpredictability of the disease, may cause some stress for you in that you may not always know whether or not you're going to feel up to doing any of the activities or things that you enjoy doing around the holiday season. Scleroderma can be an invisible disease, and some people you may look okay to others sometimes and fine from the outside, but on the inside you may feel physically and emotionally not yourself, or drained, or not feeling well, and it may be hard for people to understand that because they can't actually physically see the symptoms you're experiencing. At the same time, however, scleroderma can also change the way we look outwardly, depending on the severity of your disease, and may change our appearance and how we look. So, seeing some people over the holidays that we may not see on a regular basis may be a big change for both you and for them, because some of these changes may have occurred since the last time you saw them. And because of this, people may ask you questions about your appearance or health that may make you uncomfortable or increase your stress level, or even in the anticipation of people potentially doing that, even if we don't know whether they're going to ask you questions or not, can create a heightened sense of anxiety or stress before seeing friends or family or people in the community ahead of time. Setting unrealistic expectations of what the holidays mean and what we're supposed to do and participate in can also create a level of stress, because we have a certain idea of what the holidays are supposed to look like and what we're supposed to want to do. and participate in the holiday season, and that may not always be what we're able to do. And so having unrealistic expectations can create an increased level of stress. And also food, the holidays are really defined by food to a certain degree, and what we eat, and having big meals, and eating lots of different foods that we don't normally eat during the year. For many people with scleroderma, you may have some difficulty eating some things that you used to be able to enjoy, or eating as much as you used to, and because scleroderma can sometimes affect our GI tract and our ability and our appetite. And so the holiday menus that people serve may not meet your dietary needs, and that brings its own level of stress of, do I say something ahead of time to people, or do I not want to have people go out of their way for me, or feel like you're causing a problem, and so this can create its own level of stress, and trying to negotiate that, what we're able to eat and how that impacts our ability to enjoy holiday experiences. So some tips for coping with these stressors. Eugene touched on some of these when he was discussing coping with depression and the holiday blues, but additional ones are, it's really important to put yourself and your needs first. And, only you can gauge what you are and aren't capable of handling and doing. So it's really important to read the messages your body is sending to you. So, try not to push yourself if you do not feel up to participating in holiday-related activities. And, rest and try to maintain normal routines as much as possible. That can be difficult sometimes if you're out of your comfort zone or out of your element, especially if you're traveling. But if you're able to keep some of your normal routines and feel like, you're remembering to take your medications and take some time for yourself and rest, that can be really important and help alleviate some of the stress of then participating in the activities that you may really want to participate in. Some other things that are important is that Eugene mentioned this, but, it's really important to take time for yourself, like I just mentioned, but it's also important to try not to isolate yourself. So, by surrounding yourself with people who are supportive, caring, and understanding of your needs, that can really alleviate stress and feelings of sadness, and can help you feel like you have a good support network, and lift you up during the holiday season. Support can mean a number of things for a number of different people. So, it's really important to seek support from people that you feel are understanding of your condition or want to understand your condition and your illness. So that can be from either friends or family or from professionals, your doctor or a therapist or a social worker, or even from a group like this with other people in your life who may also be experiencing similar health issues or chronic illness or, scleroderma related conditions. It can be really helpful to talk to other people who may be experiencing similar physical and emotional feelings that you are. We will be providing Joanne at the end of this talk with a list of resources to disseminate to everybody that can, help you possibly cope with some of the different stressors that you're feeling either around the holidays, but also just in general with having a chronic illness. One thing that can be really helpful, I mentioned before that sometimes you may see people that you haven't seen in a while who may have some questions, or you may anticipate have some questions about your medical condition or your appearance. And, it can be helpful to practice what you would say if someone asks about changes in your appearance. Knowing what you would say ahead of time may make you more comfortable in a situation that otherwise you may feel uncomfortable in, or anticipate you may feel uncomfortable in. And most people are just curious, concerned, and want to be helpful. But sometimes in that moment it can feel a little upsetting or stressful to worry that somebody may ask you a question that you're not sure how to answer or you're uncomfortable answering. We've mentioned this before, but set realistic expectations and goals for yourself. It's really important to acknowledge your strengths and limitations, and that can help you prioritize what holiday activities are most important to you. Accepting that you may not participate in all activities can help you manage your expectations. You may have before participated in a number of different activities or been the cook in your family or hosted all of the parties, but Now it might be good to say, okay, this time I'll just cook, but maybe somebody else can host. Or maybe, you can have a family member or friend help you cook and host. So those can alleviate some of the burdens that some people may feel wanting to take on some of the activities they really enjoy, but they're just not able to fully enjoy by themselves, or they can't do by themselves anymore. We'll keep saying this over and over again, but rest is very important. At the holidays, a lot of activities and a lot of excitement and fun, but it can also feel very overwhelming, and if we push ourselves too hard sometimes, it can almost have a worse consequence because we can then crash the next day. And I've had many patients tell me before that, sometimes they find that when they really push themselves and do something that they want to do so badly, the next day they feel like a lot worse because they pushed themselves so hard and didn't really read the signs from their body telling them, okay, you can only do certain things in moderation. So rest is super, super important. And manage your time. Giving yourself enough time to do an activity that is important to you may help you feel like you're able to complete that task. So, for example, cooking a dish, giving yourself that extra time to cook the dish rather than feeling rushed may help you also just enjoy that time and being able to cook the dish that you enjoy rather than feeling, like it's a burden or it's not something that you're looking forward to doing. Also, decorating your home, maybe doing that in stages rather than doing it all in one day or one morning. And buying presents, one thing that can be very helpful these days with the internet is shopping online. And that really helps to avoid lines and stressful experiences in malls or shopping centers. Going on a computer and just clicking on a button to buy something can actually make you feel like you're doing something that you enjoy or that you're purchasing things for others, while also being able to enjoy that rather than feeling like it's a burden. And cooking, for example, if you cook a familiar recipe to you or you buy something that's pre-made that you would also be able, you'll be able to eat at an event, may help alleviate some of the stress of feeling like there may not be anything for you to eat at a family or member or friend's house. It's also really important to discuss ahead of time with those that you spend the holidays with that you may have to cancel plans last minute depending on how you are feeling. And doing this can help you manage others' expectations so that you don't feel like you're letting people down. If you plan on traveling, make sure that your travel arrangements are refundable in case you're unable to travel last minute. And if possible, use a mode of transportation that is most comfortable for you financially and or physically to get you to your destination. You can redefine what giving means. This kind of goes back to what I was talking about earlier with shopping being a stressor and buying gifts. So a gift can be provided in lots of different ways besides materialistic goods. So if you plan on buying gifts, it's important to set a budget for yourself if finances are a stressor for you. It's also important to manage holiday stress and use techniques that have helped you to de-stress in the past. Examples of some techniques that people have told me that they find helpful include relaxation techniques or physical activity or exercise. Even just if it means, reading a book for an hour, just kind of taking your mind off of things and putting yourself first and relaxing is really important. And going along with that, evaluate how you're feeling physically and emotionally. Only you know what you can and cannot handle in any given moment or day. And lastly, the holidays are a lot about eating and drinking, and, enjoying a holiday cocktail or a glass of wine can be a nice way to relax and feel festive. However, small amounts of alcohol can affect your mood, and be mindful that alcohol can make you feel more depressed and interfere with your medication. So it's important to talk to your doctor if you plan on having some, drinking at all over the holiday season, so you make sure that there are no interactions with your medications, and you also want to make sure that you're not using alcohol to, as a coping mechanism to help you handle any stresses that are that come up during the holiday season, because that can become problems than help. So I think, this time we're happy to take any questions. Eugene and I both work for the Hospital for Special Surgery and work very closely with the Scleroderma, Vasculitis, and Myositis Center of Excellence here at the hospital as psychosocial support and resource for that center. So we'll open up the floor now for any questions.
Does anyone have any specific questions about how you can handle certain things that might be coming up over your holiday season? I'm not hearing any questions for both of you folks. You've done a great job really in answering those questions that do come up about how to handle your stressors when you're not feeling well or when you're concerned about your budget and your time and your aches and pains. So I'm not surprised there aren't any questions.
Okay.
Great.
Well, and we'll send you that list of some resources for people to have as well, and then you can distribute that as you see fit.
And we'll also
Thank you, Eugene. Emily, I appreciate both of you being here today and sharing all the. I will certainly disseminate that information to anyone who has. Thank you.
Thank you, and we'll also include our contact information in case anybody has any questions, additional questions.
That would be wonderful. Thank you so much. Have a great holiday.
You too.
You too.
Happy New Year.